Dr. Fatunde, let's talk a little bit about adult orthodontics in specific. Which adults are kind of like doing that? Why are they doing it? Why are their teeth not straight in the first place? Why are, the alternative from, let's just say, a person putting on a couple to 3 veneers in front versus orthodontic. Anyway, tell us about how it goes about with an orthodontist, with an adult.
Well, adult patients are a very unique group of patients because by the time they get to the orthodontist, they already know what they want. They know what bothers them about the teeth. It is not unusual for the 12, 13-year-old to come into the office and I ask them, okay, why did you come see me? And they smile or they say, ask my mom. That's not what it is with an adult. By the time an adult comes in, that adult will tell you, I don't like the way this tooth looks, or I've always wanted to to improve my bite, but I had to take care of the kids' teeth first. So they're very specific. They know what they want. And it is very good because their focus already is a good guideline to what needs to be done. With adult orthodontics, there are other issues that we also must look at. We must look at the periodontal health of the adult. The gums and the bones do support the teeth, and over time, sometimes adults have lost some teeth. The bone has thinned out, or the term we use is atrophied, and some adults also have gum disease. They still can be treated, but then it's important for us to work together with the gum specialist when treating an adult. Some adults also have other medical problems. Some adults have high blood pressure, and braces does not necessarily contribute to high blood pressure. But in treating the adult, we have to bear in mind that there are some other factors to consider. So we'll always, when an adult comes in, we take a full medical history, even as we do in children. But in addition, while in children, we'll check with the dentist if they had the cleaning the last 6 months. In an adult, we will also want an opinion from a periodontist or a gum specialist to ensure that we have healthy gums and bones through which we're going to move the teeth. And then any other problem that the adult may be dealing with, we want to keep in contact with the specialist that is handling them, because we are treating one whole person. I may be working in the mouth, but that mouth is part of a whole body. And it's very important for us to understand that for the adult, whether for the adult or for the child, it is total health that we are aiming at. So the fact that we have additional health factors in adults to deal with is no barrier to orthodontic treatment. It's simply working together with the other healthcare providers that manage the adult.
All right. Now, what about the actual treatment then? For instance, let's just say an adult just simply doesn't like 2, 3, or 4 teeth in front, and rather than that, he's quite okay. But they're misplaced in terms of in terms of the way they're placed. Maybe the size is good, the color is good, and all that is fine, just not quite placed. Is that treatment usually also taking a couple years like it does for a full mouth, or does that usually go a little slower? Do adults qualify for the Invisalign or the invisible brace anyway? Tell me.
Well, it all depends on what the concern of the patient is. There are patients who will say, I simply want to straighten my front teeth. It is my responsibility to let them know, okay, I see the front teeth and I understand what your concern is, but there are other teeth that also need to be addressed. Sometimes you have teeth that are missing, in the mouth. We will explain the full comprehensive treatment to the adult. But when the adult says, okay, I only want to straighten the anterior front teeth, then we'll let the adult know, okay, if we do that, for instance, if there are missing teeth, you also need to follow up with your prosthodontist or your general dentist about replacing those teeth. Because if you don't, then it's going to affect neighboring teeth. Wherever you have teeth wherever you have teeth and you have space adjacent to them, the teeth will tend to lean towards that space. And that will eventually affect the bone support and the periodontal ligaments of those teeth. Therefore, we want to encourage the adult. Already we will be working with their periodontist or with their general dentist, so we will always have that feedback to let the other care providers know, okay, we may straighten the anterior teeth, but there are other issues that must be addressed. And oftentimes the adults have, you could say they have a priority list. They might tell you, okay, I want to take care of this now, and this one I'm going to wait until this time to do it. As long as there is that communication and there is that awareness, and we'll let them know you need to have this done, you need to have this done, and we are able to communicate it to the other providers. Then once we'll take care of what is the primary objective of the adult in coming to the orthodontist, but we'll also let the other providers know that this patient is expected to follow and get this done, and we get the consent of the patient, of their awareness that they have been advised of the total treatment.
Right. So what you're saying is basically that sometimes an adult comes in and he wants to have one part fixed, but that wouldn't work because something underlying else has to be fixed also in order to make that work.
Yes.
You know, like let's say a homeowner, he tells a guy, I want my shower to be moved there, and the plumber says, well, that doesn't work because you have this and this and this problem going on, or it's not there, we need to, and then it becomes a much bigger job sometimes, not always, but so the people need to be aware of. But so to the question, so can adults also have those invisible aligners? Is that good for them?
Yes, they can. It all depends on, what exists in the mouth, what teeth need to be moved, how many of them, and how much movement. The clear aligners can only do so much movement. They cannot do all the movement. For instance, if there's need for movement with the jaws, we're probably going to need to involve a surgeon as opposed to use clear aligners. And sometimes an adult will tell you, I only want the clear aligners, but if it's not going to do the job effectively, it is that I will let the patient know this would only go so far. And then the patient will make the decision whether he wants to start at all or, is not going to go with the recommendations. So yes, they can have the clear aligners. They can use the invisible braces, whether to move a few teeth or to move the entire teeth. Adult treatment, like I said, often involves multiple providers. Sometimes a surgeon has to be involved if part of the treatment is to also move the jaws.
So basically, yes, everybody can have be it a child or be an adult, they can have the invisible, they can have the other one, but it's not only a matter of what you want, it's a matter of what does which job. So there is sometimes a time where only a wire brace will do the job, and sometimes, yes, the Invisalign or the clear aligner can do the job. And of course, only a dentist, only an orthodontist for that much really will be able to make the best decision. Otherwise, well, again, you go to some professional who says yes to everything the client wants, and just because that's what he wants to sell him, and then the outcome isn't good, and then everybody is unhappy in the end. So that's, well, again, wonderful. That's important to know that it's Invisalign or these clear aligners or braces. There is some choice of the patient, but at the same time, sometimes his choice cannot be accepted because simply he needs the other treatment. And that's why we go to a doctor. That's why they say doctor's orders, right? Thank you very much.
Thank you.